Let me just bring in Professor Natsidi into the conversation. Prof, I'm just thinking that, in relation to the theme for World Health Day, International World Health Day, which is healthy beginning and hopeful, I hope I'm getting it right, future. Of course, in terms of maternal and infant mortality, the indices should tell us whether we are going southwards and northwards. And there are really very disturbing figures that we've gotten. Maternal mortality rate currently stands at 576 per 100,000 live births, making us the fourth largest in the world. And then when we talk about, maternal deaths, we're having, close to 10% of pregnancy-related global maternal deaths. And of course, like I said, our infant mortality rate at birth in the world is also disturbing, having the second highest. So in terms of the theme for this year, what do you think? Are we making any impact at all?
Okay, thank you for the question once again. Definitely, as we all know, it's unfortunate that a country like ours that is so endowed with so many resources, both natural and human, and with all the facilities, available to us, and will be among the poorest performing nations as regards public health indices in the world. It's very, very embarrassing. This continued, especially, with very poor health indices until about 2020, when we're thinking there will be progress and Nigeria could double up and catch up, and even, if possible, surpass where we are. So surpass the progressive countries that have attained universal childhood immunization, universal health coverage for their people. What we are seeing is the fact that there must be something missing. What has really occurred that, despite all efforts by both public and private sector and the donors, we are not making much progress. It's just like saying we have development plans, development partners, and yet there's no development. What is really, really happening? And this is so embarrassing, especially when you are among, international experts abroad attending conferences, and they portray our country to be having these poor indices. But it's unfortunate still that we can't expect much if, as we are talking today, only about 49% of healthcare facilities are providing the required services. Only about 41% of the pregnant women do have equitable access to high quality healthcare service in the country. And of course, if the funding of the health sector will continue to be what it was, I must say, I'm not a politician, but I would like to at least acknowledge the performance of this government by allocating huge resources to the health sector. Just some few years ago, the year 2001, all African heads of state met in Abuja to discuss the challenges of public health in the continent and the effect of these challenges on the development